Biophysical profiles. Legal disclaimer. Information is for general and educational purposes only. Content is not nor intended to be a substitute for professional, legal, or clinical advice. While we strive to make the information as timely and accurate as possible, we make no claims, promises, or guarantees about the accuracy, completeness, or adequacy of the information contained and expressly disclaimed liability for errors and omissions. Course objectives. At the conclusion of this session, participants will be able to verbalize the importance of understanding biophysical profiles. You'll be able to verbalize what a biophysical profile is. You'll be able to verbalize the benefits of biophysical profile tests. You'll be able to verbalize the risk associated with performing a biophysical profile. You'll be able to verbalize the different components of a biophysical profile and the criteria for coding fetal biophysical variables as normal or abnormal. This topic is important because the purpose of biophysical profile, or a BPP, is to evaluate the health of the fetus during the third trimester of pregnancy. This non-invasive diagnostic test combines a non-stress test with an ultrasound evaluation to assess various aspects of the fetus's well-being, including body movements, muscle tone, breathing movements, amniotic fluid level, and heartbeat. By examining these factors and assigning scores based on specific criteria, healthcare providers can determine the overall health of the fetus and make informed decisions regarding the need for further monitoring, early delivery, or intervention in high-risk pregnancies, or when there are concerns about fetal well-being. What is a biophysical profile? It's a test performed during the third trimester of pregnancy to assess the health of the fetus. It combines a non-stress test, which is done in triage, checks the baby's heart rate and the contractions with an ultrasound evaluation that examines body movements, muscle tone, breathing movements, amniotic fluid, and heartbeat. The test assigns a score to these areas with a total score ranging from 0 to 10. Generally, a score of 8 to 10 is considered normal, with a score below 6 may indicate potential issues requiring further evaluation. The BPP is typically done after 32 to 34 weeks of pregnancy and is a safe, painless, and non-invasive procedure that poses minimal risk to both the mother and the fetus. It helps healthcare providers assess fetal well-being, determine if early delivery is necessary, and monitor high-risk pregnancies or conditions like decreased fetal movements or fetal growth problems. Benefits of biophysical profile test. Assessing fetal health. BPP test helps healthcare providers evaluate the overall health and well-being of the fetus by assessing various parameters like body movements, muscle tone, breathing movements, amniotic fluid levels, and heartbeat. Early detection of issues can be detected early, allowing for timely interventions to prevent complications. Guiding clinical decisions. The results of the biophysical profile test guide healthcare providers in making decisions about the need for early delivery or further monitoring based on the fetal health status. There are many benefits to a biophysical profile. It's non-invasive and safe. It poses a minimal risk to both the mother and the baby, making them a safe tool for antepartum fetal assessment. They can be used in high-risk pregnancy management, particularly in high-risk pregnancies or when there are concerns about the baby's health. A BPP test is a valuable tool to monitor and manage the pregnancy effectively. The scoring system for evaluation: 8 or 10 indicating normalcy, 6 being borderline, and below 6 suggesting potential issues that may require further attention. Risks associated with performing a biophysical profile. The risks associated with a biophysical profile test are minimal. These tests are non-invasive, painless, and pose no real risk to either the mother or the baby. However, there is a possibility that the test may cause increased stress levels for the mother, which can have a secondary negative impact. Additionally, there have been concerns raised about the potential for false positives where the test may indicate a problem when there isn't one. It's important to note that while the test itself is safe, the interpretation of the results by healthcare providers is crucial to avoid unnecessary interventions. Repeated ultrasounds, which may be required for biophysical profiles, have raised concerns about prolonged exposure to ultrasound. But the benefits of these tests in identifying potential issues in the fetus generally outweigh the minimal risk associated with the procedure. Components of a biophysical profile. Fetal heart rate monitoring, which is known as a non-stress test. This component involves monitoring the fetal heart rate using electronic fetal monitoring equipment. The test assesses the fetal heart rate response to fetal movement. A reactive non-stress test characterized by an appropriate increase in heart rate with fetal movement is indicative of fetal well-being. Fetal breathing movements. This component evaluates the presence of rhythmic fetal breathing movements, which are indicative of central nervous system integrity. Absence or decreased frequency of fetal breathing movements may suggest fetal compromise. Fetal movements. Assessment of fetal movements evaluates the frequency and quality of fetal movements, which reflect neuromuscular function and overall fetal activity. Adequate fetal movements indicate fetal well-being, while reduced movements may indicate fetal distress. Two more components of biophysical profile are the fetal tone. This component assesses fetal muscle tone, evaluating the presence of active movements with extension and flexion of limbs. Normal muscle tone suggests proper central nervous system function, while abnormal tone may indicate neurologic dysfunction. Amniotic fluid volume evaluates the quantity of amniotic fluid surrounding the fetus. Adequate amniotic fluid is essential for fetal protection, nutrition, and lung development. Abnormal levels may indicate fetal compromise. So all of these parameters or variables should be performed in a 30-minute period. So fetal breathing movements, one or more episodes of greater than 20 seconds within 30 minutes. Gets a score of 2. That's normal. Abnormal, absent or no episodes of fetal breathing movements within 30 minutes. Gross body movements, 2 or more discrete body or limb movements within 30 minutes. Episodes of active continuous movement considered as a single movement. Okay, that gets a score of 2. Abnormal is less than 2 episodes of body or limb movements within 30 minutes. Fetal tone, 1 or more episodes of active extension with return to flexion of fetal limbs or trunk, opening and closing of hand is considered normal tone. So that gets a score of 2. Abnormal, slow extension with return to partial flexion, movement of limb in full extension, absent fetal movement or partially open fetal hand gets abnormal, which is a score of 0. So reactive fetal heart rate, 2 or more episodes of acceleration of greater than 15 beats per minute and greater than 15 seconds associated with fetal movement within 20 minutes. So that gets 2 points, and anything different than that or less than that is abnormal. And qualitative AFV, amniotic fluid volume, 1 or more pockets of fluid measuring at least 2 centimeters or more in a vertical axis gets 2 points. Or abnormally, if there's no pockets or the largest pocket is less than 2 centimeters in a vertical axis, that's abnormal and it gets a score of 0. In conclusion, a biophysical profile is a test during the 3rd trimester of pregnancy to assess the health of the fetus. It combines a non-stress test, which checks the baby's heart rate and contractions with an ultrasound evaluation that examines body movements, muscle tone, breathing movements, amniotic fluid volume, and heartbeat. Performing biophysical profiles during pregnancy offers numerous benefits, including early detection of potential issues, monitoring fetal well-being, reducing the risk of adverse outcomes, and providing reassurance to expectant parents. These tests play a crucial role in ensuring the health and safety of both the mother and the baby throughout the pregnancy. While the benefits of performing BPPs often outweigh the risks, it's essential for healthcare providers to carefully consider the indications for testing and to discuss the potential benefits and limitations with expectant parents to make informed decisions about prenatal care.